Hi, I'm Jennifer Allison. I'm an Associate Director of Nursing and Midwifery at NIHR in the new Nursing and Midwifery Office. I'm a matron at the NIHR Southampton Clinical Research Facility. I'm a theme lead for the UK CRF network, but I'm here today to speak to you as president of IACRN, the International Association of Clinical Research Nurses, about their new Clinical Research Nurse Board certification. I'm really delighted to be here, even though we're not really here together. It's wonderful to be speaking to an audience of clinical research nurses. And I know this is going to have been a really successful day, and I'm so excited and honored to be asked to speak today. So thank you to the organization for that, for the organizers. So today I'm going to give you a little bit of background about IACRN and about the organization that we've set up and the certification process that we've created and what those requirements are, and think a little bit about what the future might be around this, which is, I think, a very exciting one. So IACRN grew out of the General Clinical Research Center Nurse Managers Association. So the GCRCs were funded by NIH, American Research Funding, Department of Health, government funding, huge endeavor across all the states of America. There were these research centers, and they started in about the 1960s. But about 15 years ago or so, the funding streams changed. And what had been a really vibrant nurse managers group was forced to rethink how they would proceed because their funding had disappeared. They were no longer going to be available. Um, it was no longer going to be available for them to travel and to meet and collaborate together. So they decided then that they'd create their own organization, and they wanted it to be open not just to nurse managers, but actually to all clinical research nurses everywhere, and not just in America, but internationally. So IACRN was created, and it now is funded by membership dues, conference fees, sponsorship, and donations. And we have a clear vision and mission, which is really quite simple when you think about it. It's about maintaining research quality, enhancing that, and the safety of participants through a specialized nursing practice. Our mission has been to create a specialty practice of clinical research nursing and to develop opportunities to educate and ensure the professional development of clinical research nurses around the world, and thereby ensuring the safety of our patients and participants. The structure of the organization is a standard one with the president. I hold that office until the end of this year. Then I'll be on the board next year as a past president for continuity, as well as having a president-elect who will be looking ahead. And that trio works really well this past year. It's been really exciting to collaborate a bit closely with the two women in those posts. Secretary, treasurer, member at large, and a global member at large, really important. So that ensures that there's somebody international on the board at all times. And that post at the moment is held by somebody in South Africa. It had been held by somebody from the UK before. So there are lots of opportunities for people to be involved. The committees are like the secret engine of the entire organization, really active, really important, keeps us moving forward, as do our chapters. So chapters can be across a country, like Japan, or the UK and Ireland, across two countries. It can be regional, like Ohio Valley. It can be a state, such as Florida, or a city like Houston or um, New York City. So it really, anything that the leadership thinks will work probably will, and it will meet the needs of the local clinical research nursing community. That's the important thing. So we're very excited. The UK and Ireland chapter, Gordon Hill and Claire Whitehouse are the co-chairs of that at the moment. And I know they'd be very interested in hearing from you if you're interested in joining them. It's a great group. We have strategic initiatives all about moving the organization forward, advancing the structures, and ensuring that specialty practice for research nurses is disseminated through the scopes and standards and now through certification. And we really look after the professional development of nurses consistent with our mission and vision. And we're very excited about the opportunities we offer to our membership. So we're young and we're small, but we're very mighty. And we now are across 19 countries. The bulk of the membership is in America, but it's now spread across the world. Really delighted to see the most recent members from the Maldives, and I think Jamaica was a new flag I had to put on as well. We have a conference every year in October over 3 days, which is really fabulous. And we were able to pivot really quickly last year. Despite everything that was happening, we were able to hold our virtual conference in October and had 250 delegates. And we were really proud of that achievement. And they came from everywhere. And we will always have a virtual component to our conference now, I think. So the path to specialty practice has been a long one, and it's been the hard work of a core group of individuals really who created the scope and standards of practice. I've almost completed the publication of the core curriculum. We had wanted that to happen prior to certification, but it's happening now in tandem, really. We're waiting for the ebook uh, and the system of payment to be set up, and that should be within the next couple of months. So it will be on the website and easy to download. So that's a very exciting, important piece of our puzzle. But we didn't want to delay certification, and we had the 1st of April in mind, and we were able to meet that. So we were really delighted with that sort of soft launch, and we're looking forwards to October when we expect many more submissions. So scope and standards is really important because that describes in detail the difference between us as clinical research nurses and our general colleagues. It also clarifies this for our colleagues, which is important, our multidisciplinary team colleagues, and for the public and our lovely patients, of course. And it provides a foundation for certification. And it is a resource that can be used internationally and is being used internationally, which is very exciting to see. So the core curriculum, along with the scope and standards, will provide this foundation. Just going to see if I can move that a little bit, and establish this specialty practice certification. So it's about the knowledge, the skills, the expertise, and the clinical judgment that's required. This credential, CRN BC, very exciting. Can't wait to have those initials after my name in October, I hope, um, is the only nursing certification that recognizes the expertise of clinical research nurses. And it's earned through a professional portfolio. We took that decision, and I think it was the right one. And we worked really hard to make it internationally obtainable. And it validates our performance as experts in clinical research nursing. And we followed the guidelines of the Accreditation Board of Specialty Nursing Certification, which is the only such body that certifies clinical research, any nursing program. And we wanted ours to be part of that as well. So it is about advancing our knowledge and skills, and it's a continuing process to maintain. So this isn't for new graduates. This isn't for people who are brand new to research nursing. This is about showing our commitment to the work of clinical research nurses and demonstrating our expertise and judgment. And it's a value-added achievement. So it exceeds the minimal requirements. So it's more than just a research, nursing license or registration, as we would call it here in the UK. It's more than just the scope and standards, which are the minimum standards. So that was something that we had to work really hard to develop. So it's a 4-step process. So it's about practice hours and license or registration. It's about continuing education records, and it's about professional development activities along with a written exemplar and a CV, of course. So you need to document your license and your practice hours. So this isn't very difficult for us to do, is it? So we have an unencumbered nursing license or registration to practice. You have to be practicing for at least 2 years prior to application for certification, and you need to have 4,000 hours as a clinical research nurse within the previous 3 years. So again, it's not for someone who's new to the role. So for continuing education, the focus has to be within the last 3 years as well. There's a number of points that are given for every activity, and you need to have a minimum of 36 points within the last 3 years. To document professional development within the last 5 years, um, there's number of ways to do that. And I was really keen that this was something that would really be specific to the role of the clinical research nurse and the sorts of things that we do as clinical research nurses. So this isn't just an academic achievement, this is about our professional development. And between the step 2, the continuing education, and step 3, the documentation of professional development, the points earned would be 100. Some of the things that you could get points for would be presenting posters, podium speaking at presentations, such as this one, um, writing SOPs, editing, writing articles, working perhaps as a committee member for IACRN or on the board, being a preceptor or a mentor to nurses or to novel investigators, as well as academic education. So it is something that clinical research nurses who aren't going down a clinical academic route would also be able to obtain. Then there's a written exemplar, which relates to our own personal growth and development and our practice and the way we work within our team and collaborations, as well as specific quality and safety. And there's a rubric that helps to explain this on the website as well. So the importance of recertification. So it was decided by the team creating certification that they wanted to show what would happen at the end of 5 years. So you achieve your certification in October, it's good for 5 years. Then what do you have to do? So they've created 2 options, and along with practice hours, again, within the 5 years, it's 4,000 practice hours, which is equivalent to like half time working as a minimum. And the point system is similar to the certification that was done in the first instance. And again, all of this is clearly explained through some guidance documents on the website. There are 2 windows each year. They're going to be open 2 weeks prior to the deadline. So mid-April and mid-September, submissions will be accepted, and the fees are reasonable compared to other certifications that are available. So it comes, when I calculate it in pounds, to being equal to about £50 per year for members to achieve this. So how does this work in the UK? How does it work anywhere outside America? These are discussions to have, but it's here and people want it. I think it demonstrates that we value our nurses. I think that we have amazing new recognition for clinical research practitioners within our teams, but I know nurses are asking, what about us? I wanted to get this recognition too. There's nothing that I have that I can sign up to that shows I have this research expertise. And I think this certification fits that really well. And I am in discussions with the director of workforce at the Clinical Research Network about this, and thinking about how we take it forward. But it is here, and people will be going ahead And I guess it's for us as leaders to think about how do we support this and how do we um, encourage people to think about how their contribution is recognized. So I'd like to thank the leaders of the CRNBC. So Shauna, Meg, Tam, and MJ have been amazing. They were the same people that wrote the scope and standards with input from colleagues around the world. So hugely dedicated group. Lots of information is available online, including a handbook and submission instructions, the rubric, application checklist. So do go to iacrn.org and have a look around at the organization. And I hope you're going to consider joining us because it's a fabulous organization. And we are always open to have colleagues joining us from wherever they are. Follow us on Twitter. IACRN, the UK and Ireland uh, branch, has their own Twitter feed as well, and they're very active with that. So look forward to discussing this further with you all, and I hope you enjoy the rest of your conference, and thank you for listening, and do take care.